My name is Jennifer Maranki, and I'm an Associate Professor of Medicine and Medical Director of Endoscopy at Penn State Hershey Medical Center in Hershey, Pennsylvania. I've been a member of the GIE Editorial Board for a number of years, and I'm here today to talk to you about our article entitled GIE Editorial Board Top 10 Topics, Advances in GI Endoscopy in 2019. To identify major new advances in 2019, the ASGE's GIE Editorial Board reviewed original research articles pertaining to GI endoscopy published in 10 major journals plus GIE. The journals were selected on the basis of impact factor and included medical journals such as the Annals of Internal Medicine and New England Journal of Medicine, gastroenterology journals such as the American Journal of Gastroenterology and Gut, and specific endoscopic journals including Endoscopy and GIE. Reviewing the titles, each member of the 9-member board independently identified 10 areas of endoscopic research that they considered a top priority based on the criteria of significance, novelty, impact on national health, and impact on global health. The list from each individual member was compiled, and then votes were tallied to identify the consensus top 10 topics. Each member of the 9-member board then individually searched the literature broadly on the selected topics of interest. Each board member wrote a section of this document summarizing the important findings published in their assigned topic in 2019. The written sections were then compiled into one document and harmonized for style by the board chairman, Dr. Amitabh Chak. The compiled document was then reviewed by all committee members and select chairs of ASGE's education and research committees. The list of top 10 topics is arranged in order of priority based on the number of votes for each topic. The top 10 topics are as follows. Number 1, endoscope disinfection. Number 2, computer assistance and artificial intelligence for endoscopy. Number 3, endoscopic sleeve gastroplasty. Number 4, improving adenoma detection rates. Number 5, evolving techniques for polypectomy. Number 6, enhanced imaging. Number 7, best practices in Barretts esophagus. Number 8, Thirdspace endoscopy. Number 9, EUS-guided drainage moves from the pancreas back to the biliary tree. And number 10, training competency for advanced endoscopy. In terms of endoscope disinfection, cleaning strategies, including automated drying and the use of ATP strips, were studied. An analysis of 2 infected duodenoscopes revealed multiple areas of breakdown, prompting a call for new duodenoscope designs and reprocessing procedures. As an alternative to reusable duodenoscopes, disposable options have been developed and have been assessed in terms of cost efficiency. Another study demonstrated that after high-level disinfection, linear EUS scopes showed substantially lower contamination rates than duodenoscopes, suggesting that the elevator issues with duodenoscopes may not be mirrored in linear EUS scopes. High-impact reviews were published on artificial intelligence in GI endoscopy, reaching virtually every organ. Its emerging utility was acknowledged by the ESGE in their most recent guidelines. Reports have ranged from the use of AI in diagnosis and treatment of GI cancers. Studies also showed that convoluted neural networks, or CNNs, may also aid in detection. Other enhanced imaging techniques have been developed and studied, including CNN-based wireless capsule endoscopy. In the colon, investigators performed the first prospective randomized controlled trial of an automatic polyp detection system based on deep learning to increase ADR during screening colonoscopies. Large numbers of publications were also seen in the area of endoscopic sleeve gastroplasty. Articles were published in both GI and surgery journals, and in GIE alone, there were 10 articles on bariatric endoscopy, most of which were related to endoscopic sleeves. One single-center study reported their experience with 1,000 patients followed for 18 months, with 15% total body weight loss and 76 to 100% resolution of comorbidities. Another multi-center study and a meta-analysis showed similar weight loss results. We've started to see comparative studies between ESG and other treatments, with ESG showing better weight loss. In 2019, studies continued to focus on improving adenoma detection rates. Endocuff was shown to be effective at improving ADR in low detectors, but had less of an effect in high detectors, although it did speed up examination time by about 2 minutes. Endocuff seemed to perform about as well as a cap in 2 studies, and a meta-analysis did not show an improvement in detection of serrated adenomatous polyps with either a cap or endocuff. In a network meta-analysis of almost 45,000 patients using a variety of enhancements, low-cost optimization of existing resources was as effective as enhanced imaging techniques or add-on devices in increasing ADR. This past year also saw research focused on improving the quality and outcomes of polypectomy. Investigators examined the impact of the colonoscopy report card using the previously validated direct observation of polypectomy skills scoring system. Implementation of the report card led to improvements in scores over time. Several studies looked at jumbo forceps and snare polypectomy, with data showing similarities in resection rates for polyps less than 5 millimeters in size. A new video-based cold snare polypectomy assessment tool, the CSPAT, was also developed and validated. Underwater EMR has been compared with conventional EMR and demonstrated a higher rate of en-bloc resection with the underwater method, with similar adverse events and procedure times. Enhanced imaging was again a popular topic for published work in 2019. Most of the studies evaluated narrowband imaging, blue laser imaging, and linked color imaging compared to high-definition white light. Studies suggest that NBI, BLI, and LCI may have a role in improving colon polyp detection. Barrett's esophagus continues to be a controversial topic, and new guidelines came out from the ASGE, which included screening recommendations based on number of risk factors. The guidelines also support surveillance with the Seattle biopsy protocol, coupled with virtual or real chromoendoscopy. In a large multi-center study that followed patients who underwent endoscopic eradication, the rate of recurrence was about 25% over 2.8 years. The majority of recurrences were encountered at the GE junction, and almost 1/4 of them were dysplastic. Studies on Thirdspace endoscopy were popular in 2019, particularly POEM, GeoPOEM, and POEM-like techniques. A non-inferiority randomized controlled trial looked at POEM versus laparoscopic Heller myotomy plus Door fundoplication for treatment of achalasia. At 2 years, POEM was associated with an 83% clinical success rate versus 81.7% in the Heller group. Reflux, however, was more common in the POEM group. EUS-guided drainage continued to be a popular publication topic in 2019, with emphasis on the use of lumen-opposing stents for gallbladder and biliary drainage, as well as creation of enteroenteric fistulae. Finally, in 2019, studies on assessment of competency for advanced endoscopy training were published to help guide educators. One study evaluated the learning curve for EUS and ERCP, finding that for advanced endoscopy trainees, 225 EUS procedures and 250 ERCPs are required to achieve core competency. Models for training include ex vivo and in vivo animal models, as well as virtual reality simulation. Improvements in endoscopic training are happening through the use of validated tools for testing performance, simulation, and hands-on training courses. Thanks very much for your attention on this GIE topic. I hope you find this paper useful.